Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth, Atrial Fibrillation's Hidden Dangers, and trust me, it's juicier than your cousin's peach cobbler. Let me start with something that'll grab your attention faster than a clearance sale at Target. Your heart is skipping beats and racing randomly. This isn't normal palpitations, folks. This is atrial fibrillation, and it silently triples your stroke risk while affecting 6 million Americans. Yep, entirely true. I can't make this stuff up. Now, let's talk about what atrial fibrillation actually is, because I guarantee half of you are thinking it sounds like some fancy medical term I made up after too much coffee. Atrial fibrillation, or AFib as we cool cardiologists call it, is when your heart's upper chambers decide to throw a dance party instead of doing their job. Instead of beating normally like a well-behaved metronome, they flutter around chaotically like a chicken with its head cut off. Here's what's happening in there. Instead of organized electrical signals marching through your heart like a disciplined army, the atria receive hundreds of disorganized impulses. It's like having 200 different conductors trying to lead the same orchestra at the same time. Total chaos. This creates an irregular, often rapid heartbeat that feels like your heart is doing the jitterbug in your chest. Meanwhile, blood starts pooling in your heart chambers instead of pumping efficiently, which is about as useful as a chocolate teapot. But why should you be concerned? Well, buckle up, Buttercup, because this is where things get serious. AFib increases your stroke risk by 300%, and that's not a typo, 300%. Why? Because when blood pools in those fluttering chambers, it can form clots. And when those clots decide to take a little vacation and travel to your brain, you've got yourself a stroke. It's like playing Russian roulette with your cardiovascular system. Here's the kicker, see. Many people have what we call silent AFib. They're walking around feeling perfectly fine while their stroke risk is through the roof. It's the ultimate stealth attack. These folks have no symptoms but still face serious risks. AFib can also lead to heart failure, chronic fatigue, and a quality of life that's about as appealing as a root canal. The really scary part, it often goes completely undiagnosed until someone has a major cardiac event. That's when they show up in my office saying, "Doc, I had no idea." Here's what this looks like in real life, because I love a good story that'll make you pay attention. I had a patient, let's call her Sarah, who was 58 and thought her occasional heart racing was just stress from her job. Sound familiar? Maybe I should see some of you in the clinic. We need to talk. Anyway, Sarah ignored her symptoms for months, convincing herself it was just too much caffeine or workplace drama. Then one day during a meeting, she felt so dizzy she nearly face-planted into her PowerPoint presentation. The ER visit revealed AFib, and let me tell you, her stroke risk was higher than gas prices in California without her even knowing it. The good news? She's now managing her condition successfully with proper treatment and monitoring. But imagine if she'd waited longer. So what can you do right now? I'm glad you asked, because I've got some actionable advice that's easier than assembling IKEA furniture. First, check your pulse for 30 seconds every single day. It should be steady and regular, like your morning coffee routine. If you feel irregular beats, fluttering, or your heart racing like it's trying to win the Kentucky Derby, see your doctor immediately. And I mean immediately, not next week, not when it's convenient, not after you finish binge-watching that Netflix series. Don't wait for worse symptoms, because with AFib, waiting is like playing cardiovascular poker with really bad cards. The house always wins, and the house in this case is potentially life-threatening complications. Look, I know nobody wants to hear that their heart might be misbehaving, but catching AFib early is like finding a $20 bill in your old jeans. It's a really good thing. With proper diagnosis and treatment, people with AFib can live normal, healthy lives. But ignoring it, that's like ignoring the check engine light in your car and hoping for the best. Your heart is the hardest working muscle in your body, pumping about 2,000 gallons of blood every single day. Show it some respect by paying attention to what it's telling you. If something feels off, trust your instincts and get checked out. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.